Good afternoon, everyone. I hope you were able to join us for our amazing lunchtime panel and that you were able to grab some lunch, grab a snack, and welcome to the last session of the day. You made it. My name is Alex Corey, and I'm the Outreach and Partnerships Manager at the Louisiana Policy Institute for Children. A few housekeeping things I'm sure you've heard 100 times today, but you can chat with the hosts and the panelists. So if you have any questions or you have a comment, if you have tech problems, feel free to put that in the chat box and we will get to that. Or if you need any resources that the speakers mentioned, you can put that in the chat box as well. If you have any specific questions, please put them in the Q&A box. At the end, we'll have a dedicated time for Q&A. And so as we go along, feel free to add your questions there so you don't forget them. So let's get into our last session. First, we have Eric Mills, who's a research associate at the Kathleen Babineau Blanco Public Policy Center, where he specializes in social science research, program monitoring and evaluation, and data analysis. After a tour of service in the United States Peace Corps, he received his MS in International Affairs from the New School with a concentration in human rights and economic development. And as part of the Blanco Center, he engages in research activities that aim to improve the economic, social, and environmental conditions for all Louisianians. We are also joined by Dr. Jordan Thibodeau, who is an associate director of research, also at the Kathleen Babineau Blanco Public Policy Center. He oversees the research and evaluation of programs supporting the Louisiana Department of Education and the Louisiana Department of Children and Family Services, and statewide initiatives such as Whole Health Louisiana and the Family Literacy Engagement Pilot. His research has been published in peer-reviewed journals of child development, psychology, education, and physical activity. He's also a fellow of 0 to 3, which is a national nonprofit organization that really champions infant mental health. He has a PhD in applied developmental psychology from George Mason University in Fairfax, Virginia, but Louisiana is still home. So give me a virtual round of applause for our wonderful presenters, Dr. Thibodeau and Eric.
All right.
Hey, Bonnie.
Yep.
Let me get you queued up here, Eric.
All right, Jordan, would you mind sharing the? Great.
Well,
Okay, I'm going to get things started here. Thank you so much, Alex, for that introduction. Just to reiterate, my name is Eric Mills, and I'm here with Dr. Jordan Thibodeau. We're both with the Kathleen Blanco Public Policy Center, and we have been doing research to support early childhood education in Louisiana, primarily with the Louisiana Department of Education, but also with plenty of other organizations like DCFS. So to hop in, we are going to discuss two major projects that we hope will not only bolster the research surrounding early childhood education in Louisiana, but also have a positive influence on policy and high-level decision-making, especially when it comes to the key stakeholders, the families, the children, and the staff that work within early childhood education centers. So today we're going to be primarily focusing on two initiatives that are part of Louisiana's CCAP program. And real quick, for those who don't know, the Louisiana Child Care Assistance Program, aka CCAP, was established to help low-income families afford childcare while parents or guardians work or attend school. And it provides subsidies to licensed childcare centers, family homes, and in some cases approved relatives. So over the years, the program has evolved to address workforce challenges. And the way they've been doing this is with things like the school readiness tax credit, Louisiana's early childhood quality rating system, and something that we're going to be talking about today and something we've been heavily involved in, which is the CCAP Teacher Pay Pilot Program, as well as a budget modeling tool. Okay, so to start, we're going to talk about the LDOE Teacher Pay Pilot Program. So this program was established to support early childhood educators by providing increased compensation, so increased pay, through the CCAP program. This was launched by the LDOE, Louisiana Department of Education, and it's been facilitated by us at the Blanco Center. And the pilot program has offered awards over 2 years that have helped centers boost teacher pay. I believe one version of this is a 10% increase in pay over 2 years, and then another is an amount of $2,080 over the course of each year. And what we're hoping to figure out is, does the program promote workforce stability? So reduce turnover, reduce burnout, and improve the overall quality of early childhood education for the children. So a few eligibility requirements for this was that the center had to be a type 3 center, and each teacher had to be a full-time teacher to receive the pay. Okay, so just a little background research on teacher pay and turnover. The 2-year turnover rate in Louisiana is expected to be about 60%, so that's fairly high. And with this program, with some of the research that we've done for background information, we're hoping that with the treatment group, with the teachers that do receive a certain amount of supplemental pay, that we can reduce that 60% to around 37% for those receiving the pay supplement. Okay, so over 400 early education centers were selected through a randomization process. Like I said, half received a $2,080 supplement, and the other half received a 10% increase in annual pay. We had a control group, so centers who did not receive either of the pay increase did receive a $1,000 stipend to answer the follow-up surveys. And this has been an ongoing process. So we had most center applications approved in 2022, but over the course of the 2-year project, we've also had many centers apply and receive funding. Okay, so just a little bit about the study design, our methodology, and the analysis that is currently taking place. This was a randomized control trial. So we had a treatment group and we had a control group. And this was all done with signed consent. So center directors had to consent to the pay increase, and all teachers had to consent to the pay increase. 8 surveys were distributed across the 2-year period, and we collected center information, teacher information, and payroll information. And now we are in the process of comparing those results between the treatment groups and the control group. Okay, so just a little example of the information we collected, not super complicated. We collected the names of the teachers, their base hourly pay, and whether or not during the course of these quarters, whether they were replaced or not. And also we've collected some interesting information, I think, on centers themselves. Things like, do they have a kitchen? Do they have coffee? Do they have things that we think may or may not contribute to teacher retention and their quality of work at their center?
Just a small note on this screenshot here. I want to say something that's a note that we kind of featured here, that you see that it's just listing 7 teachers here, but we include lists for up to 30 entries for lead and assistant teachers. So we asked them, please, enter all those who qualified by working 30 hours or more a week. And, do they think they need more than 30 slots to enter that? So we're trying to be as comprehensive with this information. So.
All right, thanks, Jordan. Yeah, we have centers with as low as 5 teachers, and we've had ones up to 40 teachers, and that's not including the turnover. I think for some centers now, at the end of the pilot projects, went through about 50 teachers at the high end. So really interesting stats that we're receiving and analyzing right now. At this slide, you can see the child poverty by parish. So the parish and the highlighted regions, the gray regions of the parish show the level of poverty. And then within each parish, we have center size and location. And as you can see, predictably, most centers are in urban areas, but we do have quite a few centers in more rural areas that we've been looking at as well. Okay, and then specifically to our teacher pilot, this is just kind of a visualization of the centers we've been working with, where the control groups are, where the treatment groups are, and kind of a comparison of how many children are served per center and the children per teacher ratio for each center. So control groups have been slightly higher in most metrics in terms of the number of teachers at each center and the number of children at each center. Okay, so that was our teacher pay pilot. And just to quickly finish with that, we are in the analysis phase. So now we are taking all the data that we have, cleaning it, which has been a very long process. And we are trying to figure out statistically, analytically, if there is a significant difference between the control group and the treatment groups. And we're hoping that with that information, we can influence some high-level decision-making and public policy around increasing pay for teachers. So really important stuff, I think, to a certain degree, it might be an obvious answer to most people that, of course, if you increase pay, you're going to get a higher retention rate for each center. But it's so important that we have the actual statistical, peer-reviewed, verified research that we can show the highest levels of government so that we can influence really positive change. Okay, Jordan, did you want to say something?
Well, only to touch on that idea right as we're closing on this section that Eric talked about the literature backing up retention and turnover numbers, but that's not using experimental or what we tend to refer to as kind of gold standard randomized controlled trial data. So having randomized controlled trial data, especially at the state level at this point, is on the front edge of this research. There, to our knowledge, has only been one experimental initiative studied that I'm blanking on the state itself. I think it could have been near Virginia, which is a lot of where some of this research, Daphne Bassick's research, has been going on. And it does show what Eric is saying. It confirms that there are some positive results, but we need a consensus among the science on this, and the RCT, or randomized control trial, is saying that this is gold standard evidence that policymakers can use. So just kind of adding a little bit more to the importance of this work. So all right. Back to you, Eric, for CCAP budget.
Thanks, Jordan. So CCAP budget model, this is another project we've been working on closely with LDOE at the Blanco Center. A little less glamorous, I think, than our teacher pay pilot, but nonetheless super, super important. So this is a predictive budget model for the CCAP program, and we're hoping that it can help optimize funding allocation by forecasting things like enrollment trends, provider costs, and resource needs. So by using data-driven projections, the model can anticipate demand fluctuations, such as seasonal enrollment changes or shifts maybe due to some economic factors, and ensure that funds are directed to areas with the greatest need. So basically, some very high-level predictive accounting that we're doing. So just to quickly go through some of the data that we're using, we use a monthly churn report of the CCAP children served, those who have been added or dropped from the program, and we calculate a percentage change over time to input into the model. Same thing with payments by age. So these are payments that are distributed by age group for anyone receiving CCAP funding. We also have a weekly spend report where we see the total CCAP funding per month and calculate percentage changes over time. We have the actual fund balance of the CCAP program that we use as our main predictor. So when we input all these other percentage change numbers, we want to get at least 2 years of predictive fund balance information so that we know exactly how much money we have and how many seats of CCAP children can be accounted for and put into the program. Finally, we have a waitlist tracker. So there are many, many children on a waitlist right now waiting for their cases to be reviewed and approved so that they can start receiving funding. And we have changes over time with the waitlist. And finally, we have NOAs, which is Notice of Award, but these are the federal funding awards that Louisiana receives every year, that the LDOE receives every year. And we also take into account how those numbers change and some predictive analysis that we can do on that, so that we have a very robust predictor of funding at least to 2027. And this is actually, we've already had some considerable success with that. I believe we've already introduced 1,000 new seats to the program because of the predictors that the Louisiana Department of Education has seen so far. So this has been super interesting. Again, kind of a complex accounting and predictive process, but something that's been so important to bolstering how we distribute funding to help children and families.
No, I will describe this here, closing out our data team, and Eric, who leads the CCAP work that we do, the scope of work that we do. You know, we use a lot of these kind of inner workings and data modeling, but to you who might be potentially a data consumer, you want to know, you know, how is my region faring in comparison to certain areas of the state and maybe even to other states? What does my parish look like in terms of, you know, child statistics on poverty, teacher-child service ratios and childcare, as well as worker salary. So we have a website that produces data visualizations called www.lapolicydata.org. And for example, this visualization, it's a little grainy on the screen here, but we'll share this link in the chat for you to go and kind of, you know, look around and take a look at the data that we have fed into this data visualization. So again, we're doing the behind the scenes stuff. And as we do things with the CCAP budget modeling and we update numbers for CCAP, you know, forecasting, that will hopefully also impact some of these other sources of data that we can then provide more up-to-date information as years roll on. So this is just one example of a data visualization that that has been created by the team. And like I said, it's pretty neat because you can go in and look at individual parishes and even do comparisons within parish to you know, different metrics. That is there at your resource disposal. So we'll put the link in the chat here for you, lapolicydata.org. And if you want to check out any other work that we have going on, that's more, you know, the policy brief that we presented on earlier today, or any other research report. We've got another study that was done. There was some discussion in lunch around, you know, funding stability and creating funds through local tax initiatives, as well as other funding and fundraising sources. Well, we did a report with the Louisiana Policy Institute for Children that looks at some of those issues around CCAP and you know, various other funding sources that can be leveraged for sustainable revenue sources. And with that, we'll open it up for questions.
Thank you both. I don't see any questions yet. If you would rather ask your question and come off mute, feel free to raise your hand and I can unmute you that way.
We just knocked them out. They're
All of them already.
so satisfied with the information we've given us, that we've given them.
Yes.
Or it's a late Friday afternoon, you know, one of the two.
Both are understandable. I put the links in the chat box to both the
Thank you so much.
lapolicydata.org and then also the Blanco website that has your research. We'll also share those on the symposium website. So for attendees, if you lose the chat box, no worries. Those will be uploaded with our symposium resources as well.
Yeah, that's great. And hopefully, you know, people can, yeah, so adding that to our general recording and would be good as well. Yeah, we take a lot of pride in those visualizations and kind of what they do to update data and just provide context. There's more than just what I showed there on the website dealing with you know, educational outcomes and attainment. Again, some other aspects of need, family need, poverty. So Eric has worked on some of those dashboards. We've got other people on our team who've done that. So we've got a great technical ability.
So there are no questions. I will give you all a few minutes back. We'll have some quick closing remarks at 1:50. In case you don't join us for those and you're taking off early, I'll just give you the cliff notes of what that's going to look like. So when the symposium is over, you'll receive an email from Zoom that will have a full event survey. So also, if you haven't already, make sure that on the lobby page of Zoom events, in the top right corner, you're completing those really quick surveys for the sessions that you've attended. Just lets us know which sessions are most enjoyed, what topics people are loving hearing about, and will also help us inform the information in future symposiums. You'll also be updated maybe in a week or two whenever we have all of the resources and recordings updated on our symposium website. And so you'll receive that via email as well. So until then, if you are not joining us for our closing remarks, I hope you have a wonderful weekend. Thank y'all so much for attending and for spending your Friday with us. And thank you to both Jordan and Eric for your expertise and for sharing all of your wonderful information about just the research and the kind of pilot projects that y'all are doing at the Blanco Center. So thank y'all. Have a great weekend.
Thank you, Alex.
Thank you.
You as well.